everyone, and welcome back to another episode of Grow RDH Podcast. Today we have a guest on with us to talk about assisted hygiene. And so I'm just going to give the floor to her. This is Kaylynn, and she is going to just first give a little brief introduction about who she is and her career thus far.
Like Katie said, I'm Kaylynn. I'm a dental hygienist from Sioux Falls. I actually was one of Katie's students, graduated in 2020. And yeah, it's kind of been kind of a wild ride from there. I feel like kind of navigating 2020 was just in itself crazy.
You graduated in like one of the worst times
Yes.
ever. 2020 was wild. Dental offices all over the place shut down completely, and then very slowly went back into clinical practice. And we were in the middle of job search at that time.
Yes, job search. I had like my hand on the door at the office I'm working at now, and they called me and they're like, "We gotta close." And yeah, it's crazy. But thankfully, my husband and I got jobs. That's where we were going, and everything ended up working out. I'm now working at that office. Ended up getting hired later on in June from there. So yeah, it's just been great.
So, and you've been at the same office the whole time?
Yes.
Right? Yep. Since June 2020.
Mm-hmm.
And so you've been there about 4 years? 4 years. 2024. Can't do math. So tell me a little bit about like the organization of your office, dentist-hygienist ratio, and how you kind of have found career satisfaction within that.
Yeah, we have 5 dentists, and one of the few offices I feel like in Sioux Falls that are open 5 days a week, even on Fridays.
Are you super busy on Fridays?
We're actually really busy. Yes, so it makes it really great to have that constant work going on, workflow. So 5 dentists, we have 12 hygienists, and including myself, and actually our CEO is a hygienist too. So it's kind of cool to see how her career has expanded into that aspect of the business. Assistants, each doctor has about 2 assistants. And, we got sterilization tech, we got 19 operatories, so it's just constant go. It's pretty great.
So the main reason we wanted to bring Kaylynn on is because she has found a lot of success and satisfaction through working with assisted hygiene. And I know assisted hygiene can be a little bit controversial topic, especially when push maybe in not the right setting or the right scenario where production is really the key or the forefront. And what we've also been talking about a lot is the lack of staffing and the workforce shortage. And what Kaylynn has been able to do in her office has been able to implement an assisted hygiene protocol or process or policy, however you want to describe it, and had really good luck with it and a lot of really good success. So I really wanted to bring her on to be able to talk about how she did that and why it has been working for her and for the hygienists in your office. So just real quick, kind of get the background of what inspired or what sparked the need or the desire to implement assisted hygiene and how you went about at least researching it or getting it started.
Yeah, I'd say probably the biggest portion of it was because of shortages. We just had this big backlog of patients. And our priority in my office, and I'm sure every office, is to make sure you get your patients in and give them that quality of care that that they deserve and that you can provide for them. And, we kind of just had talked with one of our other employees. She had an assisted hygiene not necessarily a program, but they had this thing at her old office where if someone was sick, they ended up taking on the load, and that was really, really stressful. So she had given us her input on, it's not something that you want to be more stressful. You still want to be able to get that quality of time, but she just rushed, and she didn't feel like she could give proper care to her patients. So we kind of took that information and created like a staggered scheduling and kind of needed more of that option, rather than you have to do this. This is something that everyone has to do. It's something that you do every single day to get all your patients in. And I feel like, having that kind of, you use that personal touch with your patients if that's the kind of a system that you're going with. So we definitely wanted to stay away from that. And I feel like overall we've been able to do that with the structure that we've kind of got with for that.
Yeah, I think with trial and error, kind of like she experienced, when you're just forced into something or you're doing something based on necessity only and you're not thinking about how it's being implemented, it is really stressful because it's always thrown together last minute. So there is so much care and time that goes into the planning of proper execution that makes it really worth it in the end to take your time and learn what works. So in talking about the actual structure of what that looks like, can you describe the key components or the successful parts of the staggering, what is making it work?
Yeah. What makes it work is having great assistants. Hygiene, obviously, is a really important portion, but having an assistant that understands what's happening in a hygiene appointment and understands that care that's going into seeing the patient as well. There's nothing better than an assistant that can just understand your needs and what the patient's going to need.
So how did you get your assistants on board?
There was
present this.
It was kind of, again, just back to that trial and error. There was one assistant, Jenna. We love Jenna. she
shout out Jenna.
Yes, shout out to Jenna. She really just kind of has a similar drive to like me, and just is always willing to try new things. And we just kind of presented it as an option, and I wanted her input on what she's able to do with her license, what I can do with mine, and how we can kind of collaborate that and make it work for an appointment, and use the most of what we're allowed to do. So she was really open to it, and the first time we did it, it was kind of rocky, and we used two operatories, and they were actually like on opposite ends of the office, so we were running. And nobody wants to run during the day. So, we just kind of used that first time, and once we did it, we went back to the doctor and we're like, we're stressful, this is hard, and he was like, how do we get better? And so she and I really just kind of dived into it and figured out what worked, what didn't work. It's been really successful since.
Yeah. So if you could think of 3 different things, what are the 3 things that didn't work? Like, what are some of the things that you tried that were like, this isn't working?
Biggest would be kid patients and pediatric patients. Those, there's always something a little bit more intricate than a regular prophy. So I'm gonna count that as 2.
Okay, that's fine.
And then also the proximity of rooms. It's just they gotta be close to each other, or so you're not running, because if you run out of instruments, then it's like, what do you do next?
Yeah.
Type of thing. So and prepping for it is just a component that you just do not want to miss.
Okay.
Doing that.
And then the components that are working, and you had mentioned, utilizing assistants to the full potential scope of their practice. So for their polishing, their
radiographs, health history, polishing. Yes, if we're in a real dire situation, or for instance, if a patient ends up having a chief complaint that only the doctor can address, and I have in there to help with that, having her take care of and finishing that last patient with her polishing, and getting that done at the Florida application instead of that.
Okay.
Definitely.
Okay. And so you and Jenna, shout out to Jenna again. So you and Jenna kind of trial and error this, worked all the kinks out, and then how did you integrate it into the whole practice? What was the dentist role? Were they on board right away? Were they supportive? And how did they support you? Or how did they present this to their staff?
I definitely think you're blessed with some great doctors. They're very supportive of anything that we really present them, or let's give it a try. It doesn't work, it doesn't work.
Yeah.
But we found out having the exam as soon as, Jenna or the assistant would take blood pressure, med history, get you complete, and have the exam immediately. And that really just helped us slow the appointment down.
Before the cleaning.
Before the cleaning.
Yes. Music tonight.
All before the cleaning, and they've been, excellent, just great. And if there's been a time where there's things are stacked too, there's been a time where the specific doctor that that patient sees can't get in, one of the other doctors will jump in, flip around, or at the end of the appointment, I can jump in and stay in for the exam with doctors, and Jenna's taking back the next patient.
Sure. I've subbed at a lot of different offices, and there's just something different, and I understand the dentists that want to do the exam at the end because the teeth are space. But I'm going to make an argument here that the majority of most profis, they're clean enough to do the exam at the beginning. And what I've found is that working for the dentists that do the exam at the beginning, it's such a smoother transition into the cleaning. And truly, if you look at the laws and statutes of the state, they are supposed to be getting the exam done first before that because we can't diagnose, right? And so how are we doing a prophy or SRP prior to that being done? But most of the time it doesn't happen. So yes, I guess that I'm tangentially going off track here, but I do think that having the exam done before.
And I feel like it really pulls into like your patient education too.
Yes.
Like, to reiterate with them what the doctor is saying, what the doctor is seeing too. One thing that I'm fortunate with our doctors as well is, they're going to mention tissue, they're going to mention biofilm. And, generally when you think of dentists, they're going to talk teeth only. And again, that's just one thing that's great about our doctors is that the full spectrum and right? Let us kind of go in with that.
And my argument, even for the dentists that are like, well, I want to see the teeth after they're clean, you could easily do a full mouth polish, or have the patient do disclose and have the patient go brush their teeth.
Yes.
If it's that full of pleasure. But I getting the dentist to do the exam before doing this is awesome. So in terms of you personally, professionally, I want to talk a little bit about how this impacted your role at your office and how it sort of gave you a sense of the autonomy or professionalism that you weren't getting or not that you weren't getting.
I've always kind of been that type of person to kind of try and do more. And so I was always in the CEO's office asking her, like, what little projects do you have? What can I do? What can we do to improve? What information can I bring, to the office to kind of get us all learning what we're doing. And she was never told me no. She was like, let's do this. Tell me your ideas. Let's find some things. And and that kind of just blossomed into a really great relationship with her, of course, and then also that led into really great relationships with the doctors too. So I think overall it has given me quite a bit of autonomy that they really trust my opinion, and I'm actually our lead hygienist now. I'm trying to, I always try to find CEs we can do as a team and find, just anything that can just kind of help that camaraderie between us and bring us together as a team. It's like, even though we're all individual hygienists, like still they're working with each other day in and day out. And, I feel like the people that you work with really impact your enjoyment in your work, and even with your patients too. But if you don't enjoy it,
people you work with,
yes,
is truly. I mean, I've always joked, like, you could be cleaning toilets. And if you like the people you work with, you at least have a relationship, a working professional relationship that you enjoy. I think you can do any job in the right setting. I think in the wrong setting, any job is hard. Yes. And so just finding that place, finding your place, and finding somewhere that you that are valued, you're respected. Truly, I believe work culture and work environment is much more important than the nitty gritty of what you're doing. Yes, yeah. So I love that. I love that. So what advice would you have to any other hygienist that's looking into implementing assisted hygiene in some fashion?
I think it all starts with your relationship with your doctors and the team as a whole. It's not just the assistant and the hygienist that are doing it. It all comes back to even, to scheduling, letting your patients know, hey, this is a program we're doing this. Our admin team is so great about the schedule and, finding those good patients to have in the assisted hygiene chairs. And it was just a whole team effort.
Note on that. So do you flag them in your softwares? So flag the patients, or how do you keep track so that all the team knows who's a good patient? We
have little alerts for our peri-maintenance patients, and then our PO patients are different color, profies are different color. Yeah, on the software that we use. So when the admin scheduling, they can see the type of cleaning.
Sure. Yeah. So mainly it's just normal adult profies
generally.
Mm-hmm. Awesome. Yeah.
Yes. So I think, and also coming back to it is having the drive to do it. I think out of our team, I'd say at least half have tried it. There's a couple people that they don't have the interest to do it, and that's fine. I mean, it's been great to know that it's just an optional thing that we can do, and it's not something that the doctors are like, you have to do this. This is what your day looks like, and it's like, and that comes back to that culture. It's like if you don't enjoy what you're doing next to who you're working with, then it's like I don't want to do it.
And I think going slow is important because if you implement things slowly and the right way, I think more people are going to be willing to get on board with it if it's done in the right way. Whereas, like you were saying, if you push things through and they're not really worked out, or we're thinking it's going to be hard to talk people into doing that when it's not desirable.
And I had made, with Jenna, we had made like an SOP or standard operating procedure of like what your appointment should look like, going through there. Obviously, there's always a wrench somewhere. So like we had like a really great guideline, and I feel like for those who had tried it after we made this, it seemed to flow pretty well. And, it went from just Jenna and myself doing it to, like I said, at least half of them trying it.
Yeah. Good. Cool. Awesome. Any other pieces of advice or any words of wisdom you would like to share?
I don't know. Never stop learning. That's like, I just think that's kind of like my go-to thing. It's like the industry is so ever-changing, the world is so ever-changing that there's always something out there. But in the same sense, like, just be who you are and be comfortable,
And be open.
Right? Yeah.
I think that comes with that stuff.
Yeah.
You have to be open. You have to be willing to try new things. I feel like if you're not, you just agree.
Yeah. I agree.
Right? So, all right. Well, thank you so much for coming on. We're probably going to have you in again because P.S. We're just friends, by the way. So we just love to get together and talk. Hopefully, it will be just a welcome face on the podcast, and we appreciate your time. We appreciate your input. I think assisted hygiene, when done the right way, is a really great way to address the workforce shortage while still maintaining a lot of autonomy and control in a work setting. So appreciate your time. Make sure to like and subscribe, comment, and we will see you on the next episode next Friday. Thanks for coming.